All right, we are good to go. Cam, go ahead.
Good evening, everyone, especially our District 8 neighbors. I'm Cam Green, your Director of Community Affairs for the Office of Councilman Paris Gray. Of course, we are joined by our Chief of Staff, Kimmy Sauer. But tonight is a special community academy, which will be presented by the Baltimore Behavioral Health System. And I'm very excited about this one. I originally met them at a resource event back in August of last year, and we've been really wanting to bring this resource to the district. So tonight we'll have a presentation from Katie and Tavon, who are serves as the Associate Director for Community Engagement. And then at the end, we will have an opportunity for question and answer. So if you have any questions that may come up during the presentation, I ask that you drop those in the chat, and I'll be sure to, at the end, to ensure that our presenters can answer your questions. At this time, I'll hand it over to Katie.
Yeah, hey. So I'll give a chance for Tavon and Emmanuel to introduce themselves right after myself. I'm Katie Arevalo. I'm the Associate Director for Community Engagement at Behavioral Health Systems Baltimore. And we have Tavon and Emmanuel with us. I'll start with you, Tavon.
Sure, thank you, Katie. My name is Tavon Vinson. I am one of the community engagement coordinators at BHSB, and I'll let my counterpart go next.
Great. Thank you, Tavon. My name is Emmanuel Massley, and I'm also another community engagement coordinator with BHSB.
So I want to start by telling you all a little bit about 988 and how it came to be. And then at the end, I'll share some information about what 988 is, what happens when you call, who can call. But I think the history of 988 is pretty important in that it tells you about the larger system that 988 is meant to be, further than just a hotline. So 988 began here in our region with a grant called GBRICS. That's the Greater Baltimore Regional Integrated Crisis System. And it was composed of Baltimore City, Baltimore County, Carroll County, and Howard counties. And it was a $45 million 5-year initiative to invest in behavioral health infrastructure and services. The goal was to launch a regional 988 helpline with sophisticated technology, as well as mobile response teams and same-day community behavioral health appointments. The services we hoped would reduce the region's reliance on emergency rooms, law enforcement, and general 988 calling for behavioral health needs. And then we also have a 988 community ambassador focused program who were a bunch of ambassadors within the 4 counties who are church leaders, for example, leaders in their organizations, or just trusted people in the community who have experiences with 988 or mental health needs and can talk to people about what it might be like to call 988 from a one-to-one experience. So again, the overall goal was to reduce unnecessary emergency department and police interactions for people experiencing a behavioral health crisis, but we did have some system-specific initiatives. So one of those, obviously, was creating the regional 988 helpline. The way that 988 works is there is a national 988 call center, but they depend on local call centers. So Baltimore City, for example, has our regional call center that BCRI handles. And then per regions, there are more call centers. So we wanted to create ours and support it with sophisticated technology so that we could offer people real-time appointment capacity, referral tracking, and also dispatch mobile crisis units whenever we needed that. And then also we had a goal of collecting data, and that data was meant to help us understand what our region looked like in terms of behavioral health capacity. So did we have enough providers? Were we finding that people couldn't find appointments? What kind of things were people asking for when they called, and were we able to meet all of those needs? And then also our mobile response teams. We already, and I'll talk about this in a little bit, but we already had and have mobile response teams. So the goal wasn't to create them, it was to expand their capacity. And then also to have the mobile teams in Baltimore City and the general regional area meet the standards of the national best practices. So we didn't just want to have mobile response teams, we wanted to have some of the best mobile response teams. And then open access services were largely about supporting the providers. And so that was if a provider wants to provide services, but when 988 refers to them, they're unable to take same day appointments, for example. That's an issue. So then how does the 988 system help to expand the capacity of those behavioral health providers so that they can be um, a part of the support that we offer people when they call 988? And then the community engagement outreach portion is, in short, myself, Tavon, and Emmanuel. We're kind of here to support with some culture changes to increase awareness around what 988 is, and to answer questions like what's 988, who can call, and what happens if I were to call. And we'll answer those questions for you here in a little bit. So this is a bit of a timeline that I think is important in understanding what all 988 encompasses. So in 2001, Congress appropriated some funds for suicide prevention. And in 2005, we came to know that line as the National Suicide Prevention Lifeline. So you might have heard of that on TV or like on the radio, for example. That was the 1-800-273-TALK line. And then in 2007, SAMHSA and the Veterans Association got together, and the 1-800-273-TALK line became the line for suicide prevention and also Veterans Crisis Line. Then in 2013, they incorporated chat. In 2015, that line then became not just Veterans Crisis Line, Suicide Prevention Line, but it also became the disaster distress line. And then in 2020, the FCC said we need to assign this massive program a three-digit number to help people know who to call, where to call, when to call. And that's when 988 came to be. In 2020, we began incorporating texting into 988, and then in 2020 as well, the National Hotline Designation Act was signed, which essentially reincorporated the Veterans Crisis Line. In 2021, SAMHSA, VA, and FCC are mandated to submit reports to Congress. This is important because I think when we call somewhere and when we have a system that is gathering so much data, it's important to know that that data is going to good use. And in this case, the data that 988 is collecting is going to talk to and advocate for more behavioral health resources, given the need that we see based on the call volumes, on what's being asked for during calls, and the kind of crises that we're seeing in the calls. And then in 2021, we see some state funding released for 988 opportunities. And then in 2022, there is a complete transition to this 988 number that now we all know, or at least we're trying to get everyone to know. So in July of 2022, our nation moved to the first ever three-digit dialing code for suicide prevention and mental health. Some fast facts: it's meant to provide greater access to 24/7 confidential life-saving services. So it's a 24/7 service that people can call whenever for whatever. It didn't replace the existing National Suicide Prevention Lifeline, that 273 talk number. It just kind of built on it. So it expanded that same program, called it 988, and built on its capacity. And yeah, it's meant to be an easy to remember number. The hope is that the same way kids are taught, even as young as whatever age people start talking, people tell their kids, if you're in an emergency, if you need something, 988 is the number that you can call. Sorry, 911 is the number that you can call. We hope that people become that comfortable and aware of the 988 number, because we know that mental health crises happen all the time too, and they don't discriminate by age, by race, by gender. It can happen to anyone. And so knowing this quick, rapid number off the top of your head could be life-saving for many people. And so we also hope that people learn that 988 is meant to be more than just a number. It's meant to be part of a larger crisis care system. And that's part of the reason that I wanted to share this history with you all. It's that 988 is not just meant to be a number you call. We hope that you understand that 988 is part of, think of it as like a trunk, right? The trunk to a tree that's connected to a bunch of roots. And those roots are the long-term care services that you can access. But 988 is just one step in accessing that entire crisis care system. So again, we do have a national network of local helplines, and ours is one of many, and they've all been providing free confidential support for over 20 years to help reduce anxiety, depression, increase feelings of hope, and hopefully prevent suicides. Call takers provide counseling and emotional support for anyone who calls, and again, they're staffed 24/7 to provide an immediate response. If for some reason the call center doesn't answer within 30 seconds, you will be routed to a national backup network. So, like I said, when you call, based on your location, you're routed to whatever call center is nearest to you. Here in Baltimore City, that's BCRI. If for some reason BCRI wasn't able to answer your call within 30 seconds, don't worry, you'll automatically get transferred over to the national network, and somebody will take your call there. But Maryland does have an 89% in-state answer rate. So the hope is that when you call, you're not getting rerouted anywhere. You're getting in touch with someone who's near you. And then Central Maryland maintains a website called 988 that you can visit at www.988helpline.org. So what happens when you call? You will hear a message telling you, hi, you've reached 988. It'll play a little bit of music while they connect you. And then a counselor at the call center closest to you will answer the phone. Your counselor can listen and provide emotional support if that's what you want. If you say, I'm not looking for you to connect me with services. I just want to vent today and I want somebody who has to sit there and listen to me, they can do that. But if you say, I'm unsure about what I need, I just know that I need some help and I need to be connected to some resource, then they can also connect you to longer term support as well, or a mix of both of those things if that's what you need. And there's that number again, staff answer 90% of calls within 30 seconds. Who can call 988? Anyone. The answer is anyone, but we clarify this because we know people have different questions about what happens when you call. So anyone can call 988 and get routed to their local helpline. Callers are not asked about insurance and you won't be charged for calling. So you can sit on the phone call with this person for like 2 hours and keep venting if you want to. You will not be charged for the call. We do like to clarify if you are referred to resources outside of 988, those programs might incur their own charges, but you can also let the person know when you call, hey, by the way, because of insurance or whatever else, can you give me some low cost or free services? You can say that if you need to, and they can help you around that. But they can also just help refer you to places that can work with your insurance or with whatever your means are. But in terms of calling the 988 line, you won't get charged for any of the services that you receive when you call, which is, just talking to someone, getting routed to a different resource. And then callers also do not need to have any kind of proof of citizenship or documentation. We know that people have some fear around calling different numbers like 911 because of that nowadays. So we just want to say you won't be asked for any kind of proof of citizenship. Tell people to feel free to call no matter what their documentation status is. Help is also available in other languages, and help is available for people who are hard of hearing or blind. And that can be found on our website or it can be found over the phone. But please tell people to call no matter what their specific accessibility needs are. And then there's a Veterans Crisis line. This is the line we were talking about earlier that's available when you call, and you can go straight to it by just calling and then pressing 1. And then if you need the Spanish language network, you can access it by just calling and pressing 2. Lots of languages are spoken on the line. 2 is just there because Spanish is the second largest after English language spoken on the line. But you can also just call, bypass hitting the numbers, and when you reach someone, you can ask for an interpreter, translator, and you'll receive that. So who answers the calls? Call takers are local call center counselors who have received specialized training in answering crisis calls. They receive about 100 hours of specialized training. And again, those training standards are set by the National 988 Suicide and Crisis Lifeline, and they are based on decades of suicide prevention research. Call data and reports are monitored for quality and effectiveness. And additional funding that comes from that data has been used to hire and train more counselors to improve dependability and answer time. In addition to helping with emotional support need, you can also call if you or a loved one is seeking help with drinking or drugs. Those services include same-day or next-day appointments, referrals to longer-term counseling in the care, counseling or care in the community, or having teams of mental health professionals meet you where you are. So if someone is in a crisis and needs someone to come out to them to give them in-person support, then 988 can dispatch a team to you. The crisis response teams are a whole project of their own that I could probably do another like 15-minute presentation on. But in short, what I can tell you about them is that each mobile crisis team is comprised of a licensed behavioral health clinician and a peer support specialist or nurse. And BCRI, the same organization that has and hosts the call center, is also who provides 24/7 coverage for Baltimore City. And then youth-specific services are also available, and you can ask and request those when you call. So what's the difference between calling 988 and 911? You should call 988 when you or a loved one is having thoughts of suicide, feeling lonely, sad, or depressed, having relationship problems, drinking too much, or using drugs in a way that you feel is unhealthy, feeling anxious, maybe coping with trauma. The reason that this is really important to say, mental health and mental health crises can happen from 1 second to the next. So you could wake up sad in the morning, then midday you have an argument with a loved one. So now you're angry. By 5, you're angry at the world. By 8, you're depressed. By 9, you're having thoughts that you wish you weren't having, right? So we want people to think of 988 as a number that they can call, not when they're at that point of the very negative suicidal thoughts and, but you can also call it ahead of time. If you're just sad that day, we know that mental health oftentimes works in a spiral, right? And so if you just want to get ahead of it, think of 988 as a preventative service for yourself. It doesn't have to be an emergency. Of course, if you are having suicidal thoughts, if someone you know is having suicidal thoughts, we want you to call. But we don't want people to think of 988 as just a suicide hotline. We want people to think of it as a preventative measure that you can take for your mental health and your own behavioral well-being. And then, of course, you can call 988, 911 when you or a loved one are experiencing a life-threatening emergency. For example, if you need emergency medical services, if there's a fire, if you need police to be dispatched to your location. But the important thing is to call one of those numbers. 988 regularly refers over to 911, and 911 regularly transfers calls to 988. So when you speak to someone, depending on what you need, there's a good chance that the call, the whoever picks up the call can kind of assess and say, oh, you know what, this might be more of a 988 call and transfer you over. The point is just call a number if you need help. We want to get you that help. But if some of the things that you see on the left side of the screen are going on, then that's a good key to think about calling 988. So again, 988 is a community effort, which we hope would reduce our region's historic reliance on police during mental health emergencies. Most of the 988 calls that we receive are resolved over the phone, so we end up not having to dispatch any emergency personnel. By emergency personnel, I mean police officers. And if a community response is needed, if you do need someone to be dispatched, then 988 will refer to the mental health professionals they have instead of police whenever possible. And fewer than 2% of 988 calls are actually transferred to 911 or asked to dispatch EMS or law enforcement. So it's only done whenever someone is saying, for example, that they might be a threat to themselves or to someone else. People usually have that question. They ask, what are the chances that if I call and I say, I'm feeling this kind of way, then they'll call 911. They'll transfer me to 911. The truth is that if you are a danger to yourself or to someone else, if you are about to act on something, then we do want to get you help as quick as possible. And so you might be transferred over. We might call 911. But the majority of times, again, that's only 2% of times. The majority of times they do resolve it over the phone. And if you do need to see someone in person, it's the mobile response team that they'll lean on, not 911. So our ambassador program that I mentioned earlier, I want to share this quote with you all from our ambassadors. It says, I believe there is a lot of stigma around calling these numbers, though. Many think of them as talk me off the cliff resources rather than something that can begin the healing process. So again, we want you to think of 988 as a preventative measure that you can use just whenever you're feeling down, sad, whatever it is that you're feeling that you need to kind of talk to someone with. It doesn't have to be an emergency. And our ambassadors are out in the community all the time telling people this and kind of building trust with partnering with key community leaders. The ambassador program is part of how we remain true to our mission of community engagement in a meaningful way. We want to know that we have people from the community who are out there explaining how 988 works, because then they also receive feedback on what people are experiencing with 988. And then that feedback can come back to us and we can use that to improve how 988 functions. They assist with outreach and education. They are in targeted areas, specifically with high call rates. So that same data that we take, we can see what areas are seeing the highest number of calls to 988, and then ambassadors can work specifically in those areas to raise awareness. And generally, they can present similar to how we're giving you this presentation now. They can table out events and expand exposure generally for 988. This is just some of our material. You will see at the end of the presentation, Tavon, and Emmanuel's emails. Tavon is your point of contact if you would like materials. So if you say work in an office or just would like to have some to hand out to some family members or whatever it is. But if you'd like some materials, we have some little pieces like this. We also have these ones in different languages. We have flyers, fact sheets, postcards. If you would like to become a partner, you can become a partner at partners.988helpline.org and see our partner toolkit there. You can also get branded items from us, so like magnets, chip clips, pens, stress balls, for example. And you can contact Tavon, and Tavon will share the link with you for where you can put in a request for those. This is one of our Spanish language flyers, for example. The top 5 languages that are spoken on the line are Spanish, French, Mandarin, Korean, and Swahili. But again, it doesn't matter the language the person speaks. There's a good chance that we can offer interpreter services for it. So please encourage people to call, even if it's not one of these top 5 languages that they speak. Finally, what have we been doing with the newly funded programs? Well, we've expanded the number of hotline counselors. We've expanded the number of mobile response teams the way we wanted to. The open access scheduling for same or next day outpatient appointments for lower acuity callers are in place. We have a bed registry for community-based inpatient facilities. So if someone calls and needs a bed, needs some emergent help, then we can use that bed registry to place them. And of course, we're continuing with our Baltimore City 988 Ambassador Program. We currently have a cohort of 10 and we'll soon be expanding to 20 in the next fiscal year. Thank you. And if you have any questions, I can take them now, but also here's my information, Tavon's and Emmanuel's. If you would like some materials, feel free to reach out to Tavon. If you are interested in having us attend an event of yours, for example, table at a community event that you have or give a presentation like this somewhere, you can contact Emmanuel Massily. And then, of course, contact any of us for anything. We're happy to help and get connected.
Wow, that was really good, Katie. Thanks a lot. Very insightful presentation. I do have 3 questions for you, and I'm sure anyone on the panel can answer. But the first question is, how do you all track open bids with organizations?
Um, can you expand on that?
Yeah, so I think at the end you spoke to having a registry for open bids
Yeah,
in the
okay, yeah.
event. Yep.
Sorry, I'm in such work mode that I thought you said bids, like contracting bids. I was like, huh. I was like, for which one? Like, yeah, BCRI works specifically with behavioral health resource providers who have beds within the city. And what they do is they talk to them pretty often on a daily schedule and are saying, like, how many beds do you have open? And they keep that on a registry that's up to date. So then whenever you call, all of the counselors have access to that registry and can know where there might be a bed available for you. And obviously that depends on a bunch of things like your own eligibility, your location, how far you're willing to go, if you have transportation to that location. But the bed registry is there so that at least we have the most up-to-date information on what's open and available for you.
Okay, thank you. And then the next question was, how do organizations get registered within your network? For example, if if I provide housing support for individuals living with HIV, or I am a case manager for victims of human trafficking, do you refer based on needs?
Um, yeah, I would say feel free to send me an email to that email that I have up right now. We are happy to get you connected with BCRI and I'm sure they would be happy to add you to the list of resources that they have. Um, but also if so I guess it's 2 answers. One, Behavioral Health Systems Baltimore, which is the organization that myself, Tavon, and Emmanuel work for, is the local behavioral health authority for Baltimore City. So 988 is only one of many programs that are managed, funded, marketed through us. If you are looking to be part of that larger behavioral health system in terms of like grants, funding, just receiving more provider information from us, then you can email me and I can get you connected to that through BHSB, our organization. If you mean specifically you want to be one of the people that BCRI refers to whenever people call 988, then that's a different service, but we can connect you to both of those. So regardless, just send me an email, let me know what services you offer and that you'd like to get connected. And I'm happy to connect you with the right people.
All right, thank you. And then the next question says, when you say long-term support, how do you partner with local organizations for that long-term support?
Yeah, so a lot of those organizations are already providing long-term support. So, um, for example, long-term counseling, there's that goes on for, however long the person is in need. Or for example, if it's medication management, or if it's if it's a long list of things that you need that require more than just like a one-off call, for example. 988 and Behavioral Health Systems Baltimore work together to kind of keep contact with the behavioral health system across the city so that we know that sorry, I just saw the question pop up. So that we know that there is uh sorry, I completely lost my train of thought. So that we know that there's those services available. And like I said, part of what 988 is doing is looking to expand that capacity. So if organizations, for example, say we can get you in, but not until a month from now. Obviously, that doesn't work for someone who's having a mental health crisis right now. And so BCRI and Behavioral Health System Baltimore together kind of work to help organizations with capacity building in that sense. But really, it does depend organization to organization because every organization is in a different level of the care they're able to provide.
Yeah, I think that was a good answer to that one. Do you all screen the mental health providers that you refer patients or clients to?
So actually, I would have to get back to you on that one. I'm not sure what BCRI's process is for that, but I can say that they only would refer to an institution or office organization provider that is licensed. So I guess in that term, they're screened and that they're licensed through the city, the state. Um, but yeah, I could ask for more specific answer on that for you all.
Okay. The next one is we have about three more. And then I'll start with the one in the chat. What are the chances that funding will stay in place under the current administration? I imagine it's speaking federal.
Yeah, I'm actually really glad that you asked that question because I think a lot of people have that question. We are very lucky in Maryland that our state government is dedicated to 988. So um, thankfully, funding is continuing on the federal level, but despite that, we now, if you go and you look at your phone bill, you will see I think it's like a 10-cent charge, a 10-cent fee. Cam's like, yeah, I saw that on my chart. I was like, what is that? So everybody is now being charged that fee, and all of that goes to 98. And so we're all collectively paying, some cents a month when we pay our phone bill to fund 988. So 988 has its own, level of funding here in the state. So we're confident that, in the state we're sure that 988 will continue on and we'll be able to keep providing services.
Yeah, I didn't want to answer that for you. I knew the answer to that one. How much advance notice do you all need to table at an event?
We work magic. Do you have something tomorrow? No, just kidding.
Oh, well, not me. That was a question. But I'll say, reach out to you via your email
Yeah, yeah,
information.
yeah. Feel free to reach out to Emmanuel for that one.
Okay.
Um, and he can get you connected. We have a form online. So if you go to bhsb.org and you go to the community engagement web specific page, there's a website, there's a form on there that you can fill out and you can ask us to attend the event. We check it pretty often, at least weekly, if not several times a week. So we'll definitely see your invite, but on there you can put, what do you want us to do? Do you want us to present? Do you want us to table an event? How many people do you expect at the event? And then we'll make sure that we try to find a way to come out there for you. Either us, one of us three, or our ambassadors too can come out to these events for you.
Okay. And then this question is around the young adults. Someone says that they work with young adults who are chronically experiencing mental health crises at a younger and younger and even younger age. How are you all expanding services for those changing needs?
Yeah, in terms of awareness, we have hit to social media, and we've tried to take some feedback from young people on social media. TikTok was one of our, I think, larger efforts. A lot of young people are on TikTok, and They were not shy to tell us what they thought about TikTok in those comments. And so that was definitely part of how we did and we plan to continue growing the 988 program. Um, but then also we're in schools, we have prevention teams at BHSB that attend schools and do different events like Kids Off Drugs or National Prevention Week, for example. And those teams carry 988 materials as well to help kids get aware of the fact that that service is there and available to them. And if you work specifically with kids and you're interested in some of our prevention work, then feel free to reach out to me and I can put you in contact with that team.
Okay. And then a follow-up to the youth question is a part of the ambassador program. Are youth eligible to be a part of that?
Yes.
Okay.
Yeah, they are. I
Okay.
might, okay, so the ambassador program includes an honorarium. So depending on whether or not you have a checking account, I might need to talk to mom, dad, grandma, whoever's in charge. But yeah, we want ambassadors to be people who are in the community, who are well connected, who are advocates for themselves and others, and that's about it with requirements.
All right. Last two. We're good at time. It says, can you call 988 on behalf of a loved one who is experiencing a mental health crisis?
Yeah, Tavon or Emmanuel, do you want to take this one?
Sure, absolutely. Can you repeat that one more time for me?
Yes. Can you call 988 on behalf of a loved one who's experiencing a mental health crisis?
Absolutely. So the great thing about 988 is it's not just for personal. You can also call for other individuals. So some examples of that may be uh, how can I deal with someone, I'm experiencing a friend or a family member or a loved one that's going through depression. Is there some tips or different avenues that I can reach so I can assist them without being overbearing? There's also, for instance, if someone is having a mental crisis or an anxiety or panic attack, you can call and, again, as long as they're not trying to harm themselves or anyone else, you can call for the individual so that the mobile team can come and assist the situation. Uh, I think as the program expands, they in the scenarios because there's always a scenario that we have not experienced and they haven't either. There was a situation with the public library where an individual was having a panic attack and they were telling them to call 988, and unfortunately the librarian did not understand what that was and that she could have called for that individual that was saying, this is I feel it coming on call. But now we've been working with them. They understand what that is. I know they have a whole ambassador system of their own for that particular purpose. So yes, you can call for yourself and for other people.
Good. Thanks a lot for that answer. And then I guess the last question for tonight, if there aren't any in the chat, would be, do you all partner with 211? And then what are ways that folks can volunteer?
Um, I'm not sure if BCRI is independently partnering with 211. I can tell you that um, Behavioral Health Systems Baltimore, which is the organization that we work for, partners with 211 in a host of different ways. Our team, for example, is working on a asset map. So we're looking to get information about a bunch of resources in the city and compile them into some kind of document or Excel spreadsheet, for example, that people could eventually have access to see what's in their zip code, what services do they need specific based on the issues that they're having, the demographic that they come from, whether it's youth services or LGBTQIA services. Um, and we're looking to do some work with 211 around that because obviously they have a lot of that information already. So yeah, we do in different capacities.
Okay. And then I see a question just came in the chat. Hey, Miss Allen. It says, when a person is experiencing a mental health crisis, why aren't mental health counselors in attendance? And I think she's referencing in an incident that is ongoing. I guess I'm imagining once the law enforcement has already arrived.
Yeah. I will say I think we've seen some of this specifically in Baltimore City, so I think I might know some of the specific instances that you're referring to. We see it a lot, but I think some of them went kind of viral last summer. Yeah, the hope is that they would be. 988 works with 911 to encourage them to use 988 services whenever they have a caller who is having a mental health crisis, a behavioral health crisis. So we want police to use us in that way. We want them to call and to, instead of using police dispatches, if able, to refer and reroute to 988 and have 988 mental health. Those mobile crisis response teams that I told you all about, that have the nurse and the licensed professional to go out to the community member instead of the police. So it is an ongoing push and pull, I'll say, of trying to get people to know about 988 so that the number that's called is 988 instead of 911. But that requires a lot. It requires us understanding what a mental health crisis might look like. It requires a lot of people. And so all we can do is just say, we encourage you, if you're seeing someone with a mental health crisis, to go ahead and call 988. And then hopefully the people that interact with that person having the crisis is a mental health professional as opposed to the police. Tavon, I think you wanted to answer that too.
Yes, and also, as Katie said, what identifies as a mental health crisis and mania, or what, exactly what would dignify that for that particular case. Another thing about the mobile service, that I know when we're out tabling, something else we make sure the public understands that may have that barrier with police officers due to previous situations, is the fact that if the mobile team comes out, the police is not with them. They're there to de-escalate the situation. And a lot of people do, they feel that relief of, okay, I can call this number if there's a crisis without the police having to come with them. Unfortunately, having a mental health counselor in attendance for everything. I think someone asked earlier about funding and grants. You guys also think, if there's funding being cut in this area, who's going to fund that? I think though it would be lovely to have them there, but again, this is why we refer to 988. If there is a mental crisis, we want people to be able to call 988 instead of 911, so that we're clear across the board. There is no accidents that could trickle down from this particular situation. But the police officers in Baltimore City have been receiving 988 between BCRI and ourselves, receiving the little pocket cards and mental health and first aid training as well. It's something, it's a continuous push and work and on all parts, but we are trying, and so are they. Thank you for that question also.
All right, so look like hearing none, seeing none. Looks like that'll be it for tonight, y'all. I really do appreciate you all for joining us tonight for our community academy. Hey, if anyone needs any thing from this organization, of course, their contact information is on the screen. This presentation was recorded live, so it will be available on both our website, which is www.d8bmore.com, as well as on our YouTube page and as well as Facebook. So if you didn't get to see the full presentation, you'll have an opportunity to rewind and press play. Again, thank you all for joining us tonight. I hope you all have a safe night, and see you at the end of the month, where we'll be joined by the Red Line on May 21st at 6 p.m. Same place on Zoom. Thank you all for joining us again, and have a great night. Stay safe.
Thank you, everyone. Thanks,
Thank
Cam.
you, everyone.